Hi, I'm Bud Laurent, and I'm a candidate for state representative for House District 15, and I'd like to talk to you a little bit about health care in Oregon. But before I tell you about my ideas, I think you need to know that the incumbent Andy Olson, in his 6 years in office, has really done nothing to improve health care for Oregonians who have no access to decent primary care. And he even voted against last year's major landmark health care reform bill, HB 2009, and he also voted against House Bill 2116, which expanded health and dental coverage to uninsured children and low-income adults. Like many in his party, he has made it clear that he doesn't really care about the health of his constituents who can't afford health insurance. Well, we ignore health care reform and its rising costs at our own peril. As Representative Dennis Richardson has pointed out, when 4% of Oregon workers are losing their health insurance every year because of skyrocketing group insurance premiums, and Oregon families that are insured start spending more money on health insurance premiums than on their monthly home mortgage payments, we have a crisis. Well, done right, House Bill 2009 will cap rising health care costs that are bankrupting families and small businesses. What Andy Olson doesn't seem to appreciate is that spiraling health care costs have led to a tenfold increase of bankruptcies over the past 30 years and pose a threat to all but the wealthiest of Oregonians if something isn't done now.
A recent Harvard study reported about the healthcare crisis affecting Americans. Medical costs are now the biggest cause of bankruptcy. 62% of all personal bankruptcies are filed because of huge medical debt. And more concerning, the study also showed that 78% of those who had to file bankruptcy because of medical debt had insurance.
Because Olson has taken thousands of dollars in campaign contributions from Wall Street pharmaceutical corporations and medical political action committees opposed to health care reform, the reason for his voting record seems clear. One of the things I'll fight for is a system of community clinics throughout Oregon which will provide quality care to all Oregonians. Among the first effects of these clinics will have is the elimination of primary care delivered through emergency rooms, which too often serve as the last resort for those without health insurance. Not only are emergency rooms the most expensive source of primary health care, this practice also results in each of us with insurance paying an increased premium in the amount of $1,000 to $1,300 a year for our own health insurance. That's how the system pays for this sort of care. Well, these community clinics, as I envision them, can be created through public-private partnerships and will be staffed by the best and brightest graduates of Oregon's medical and nursing schools, whose tuitions are paid for by public scholarships in exchange for 3 or 4 years of service at the clinics. The community clinics will attract all levels of patients because they will become known for their excellence in care and will become providers of the first resort rather than last resort. In short, Oregon will become a model of health care provision for the rest of the nation to follow. I have a number of other ideas to improve health care in Oregon, and this is one of the reasons I'm running for state representative. The fulfillment of the promise of House Bill 2009 requires the election of conscientious, hard-working representatives dedicated to the greater good, and that's what you'll get if I'm elected.
Bud Laurent, an original, an independent, a new voice in Salem. Contributions can be made through the website at www.budlaurent.com.